Hello and welcome to Time with Dr. Rachel. Today I'm going to talk more about fibroids. So, in the earlier episode, I mentioned how people with uterine fibroids present, that means the kind of symptoms they may have. But today I would like to just try and separate these symptoms and isolate those ones that are specifically for fibroids and could be due to other reasons. Going to the loo excessively, it could be due to an infection. But how do you tell that it's an infection versus fibroids? Uterine fibroid, which is abnormal growth of the muscles within the fibroid, and abnormal growth, that is found within the womb, that it takes longer time. It's not cancer, so it could be there for many years. So if you notice that the way you go to the loo, that's to pass urine, is gradually increasing, the number of times you have to go, the frequency, that is to say, is increasing on a daily to weekly basis. And you can gradually feel a mass or a growth on your tummy or a bump in your tummy. Then you could tell that the reason for going to the loo so frequently just may be fibroids and not infection. Because an infection would not only come with frequency, it could come with, that is, frequency is increasing the number of times you go to urine. There could be associated pain. There could be history of sexually transmitted infection. So there could be abnormal vaginal discharge or history of you having other multiple sexual partners, or your sexual partner have multiple sexual partners. You see, there is a way we can tell. So you really need to speak with your doctor and have yourself evaluated to tell exactly what the symptoms are. Because either way, you need to get the best kind of treatment. Or what do you think? Exactly. Also, I talked about going to the toilet to pass feces more frequently due to the size of the uterine fibroids. And if you do feel this way, it's important for you to be sure that there's no other reason why you feel that way. Could it be that you're having problems with your bowel? Is there a reason for you to see your bowel doctors to find out exactly why this is? Is there blood when you pass feces? Is there an abnormal smell? Does the feces float or does it drop? What's the color? I know some people say, no, when I do my thing, I just flush and walk away. Sometimes you need to look at those friends of yours and say, what do they look like? If you understand what I mean. So that you can tell if there's any other problem. Because there are some conditions that are long time also that could also present with abnormal bowel habits. And so it's important for you to be able to tell, am I having something called an irritable bowel syndrome? So that just means, you having other things that could be associated with your defecating. Is there any other allergies? Is there something that I eat that makes it worse? Are there any other symptoms? So you see that, could it be fibroid? It may be fibroid. It's a whole barrage of symptoms, and signs, like we say in medicine. But to break it down simply, if you have a lower abdominal mass that is gradually increasing in size, that starts to get associated with excessive menstrual bleeding, or even sometimes intermenstrual bleeding based on the size, like if it could be at the mouth of your womb, you may be having drops of blood even after your period. Or could it be that you have these two things, the mass, the bleeding, together with frequency that is increasing, times where you go for to pass the loo, to go to the loo, as well as increasing frequency of defecation. If all of this happens, then it just may be fibroids. If you're a woman in your reproductive age and you're even black, makes it even more likely, you do need to see your doctor. Now, in the next episode, I want to talk more about the little things that you can do on your own to find out, is this fibroid? And if it is, what are my plans? Some people would say, I have fibroids, doctor. Do I have to do anything about it? Or yes, I did this or that about fibroids. Doctor, do I need to do anything? Do I need to even take them out? I'll answer more about this. But first, I want to hear from you. What questions do you have? Do you have any comments? And so, right now, I'd like you to turn on your notification buttons, press your like, and subscribe to our channel and tell us whether you like what we're doing or not. And then we can get more from us. Till then, bye.